All right, so week 5 for MN669. We're halfway there. I'm totally excited. Well, I wanted to express about a patient that she is a teacher in like a preschool kind of setting. And she is in psychotherapy for anxiety, for therapeutic, what was it, CBT, and mainly self-help, anxiety, depression, insomnia. And she's been a teacher for 3 years. Apparently she's in some kind of HR case for sexual harassment. Very manicky, very, talking word salad here and there. So the case is that she says she reached over to fix a coworker's collar, another female, and she took it as, "You are trying to touch me." It's female to female. And the patient's, she says, "I'm confused. I don't know if I like boys or girls." And now she's in a predicament where she can lose her job and have a sexual harassment case against her. So just kind of seeing like the motivational interviewing, because it was like, no, it's not me. That's just how I am and who I am. And then, probing the questions like, well, if somebody randomly would come up to you and, just even merely like sway your shirt, how would you feel about that? And she kind of staying quietly, kind of like thinking about it, and has had previous accusations at another employer prior to becoming a teacher, when she was working in a fast food restaurant. So kind of like that continued behavior and outcomes. And in the PMHNP role, it's learning the motivational interviewing, the cognitive behavioral therapy, the being patient, because you want to say, hey, you know what I mean? You're acknowledging what you did. Why? What led to that? And then like her saying a story and then coming back and adding pieces to the story. It was an hour of going back and forth. We did add Visceral 50 milligrams or 25 milligrams PAM as needed for anxiety, just to see if that kind of calmed her down. Which it's interesting how the PAM is more towards the central nervous system, which really helps with that anxiety, versus the HCl. What else? To explore your personal strengths and limitations that affect your relationship. The listening part is the strength, is just learning to they just want to express themselves. So I learned that. And then therapeutic use of self, not judging, just listening, notating the differences, and then bringing it back to their attention. Well, what you told me before was, and now you're telling me that this happened prior. So what events did this happen? Was cool to see. Specific learning insights, getting back the therapy models again, getting back the elements of motivational interviewing. I actually brought up my Kindle book again and kind of, well, how would I guide this conversation? Was pretty neat. And then we had a template when we did that therapy that I actually pulled out and used. So that was good. It wasn't like just a homework piece. Identify something specific that you learned from reflecting on this event and tell how you will apply it in the learning future practices. In those therapy med management sessions, I noticed that if you're not paying attention to the patient as they're talking and you're documenting or they don't open. They don't build rapport with you. And I saw it a little bit with my preceptor. It's kind of like, I get it, you have multiple patients, but with the therapy ones, they pick on that like so fast. But even as a nurse, you know, when you're busy trying to do meds and they're like telling you something, you're like, okay, date of birth, name, blah blah blah, and here's some water, move on. So just kind of remembering that each patient is there because they want to be heard, and now you're the nurse practitioner that can make a really big difference in their medication regimen, in their plan of care, in how they feel. So remembering that is important.